Thanks for listening today. I want to be transparent with you. Besides hosting this podcast, I also work for Everly Health, our sponsor for today's episode. However, all views and opinions expressed on the podcast are my own or those of my guests, not those of Everly Health.
Welcome to Digital MD, where we explore healthcare and all sorts of aspects of careers. Dr. Zeev Neuwirth is our latest guest. He's a healthcare executive who most recently was Chief Clinical Officer and Executive for Care Transformation at Atrium Healthcare. He has over 15 years of clinical practice experience and another 15 years in clinical operations. So he's launched a very great and exciting award-winning book called Creating New Healthcare Podcast. And he also published his book, Reframing Healthcare, a roadmap to creating disruptive change. On top of that, he is also basically done a ton of work as he's published a second book, Beyond the Walls, looking at the megatrends and movements and market disruptions transforming American healthcare. So, Zeev, we are really excited to have you. The first question I have was, you've launched these award-winning podcasts and written books on American healthcare as a physician. What's the origin story here? Can you tell us more about that?
Yeah, sure. So the story is I've been in healthcare for now over 3 decades, and like many physician leaders and executives, been working year after year to try to really improve healthcare. And about 10 or so years ago, I began to realize that what I and we had been doing, and again, I think there are decades and decades of work, wasn't really getting us closer to a solution to really resolving some of the major issues in healthcare delivery. And these are not small issues. So, for example, we've been talking about crossing the quality chasm for it's been, since before 2000, and we aren't really any closer to crossing that quality chasm than we were in, when that report came out. You look at issues of disparities in health and healthcare and outcomes of health, and again, you see a very, very similar pattern. We're really not any closer to resolving that as well. You look at the cost of care, they're outrageous. They're impossible for the majority of Americans, and that is actually getting worse, not better. You look at access, and again, similarly, that's not getting better. So, and then of course you compare what we're doing to other developed nations, or even really less than developed nations across the world and the globe. And you see, in comparison, we're actually getting worse and worse. At this point, I
So
don't even know where we rank, but
I feel
it's
like
definitely below 30.
we hear this all the time. And
Mm,
so I feel like it's been
mm,
I
mm,
think, oftentimes
mm.
discussed concept. What do you think
Yeah.
people need to know if they want to change this healthcare system that you're talking about? What advice do you give for people early in their careers or even later in their careers?
Well, I think the fundamental issue is whatever it is we're doing, let's change that because it's clearly not getting us closer to a solution. So for me, what, you were asking about the origin story of like, why did I launch a podcast and why did I write books? For me, it was really, the belief that I had to really look for divergent perspectives. I had to look for people and organizations that were really doing things very, very differently and were successful at it. And that's what I started to do about a decade ago, is I started to say, well, listen, what we've been doing, what I've been doing, is just, one new shiny thing after another, but it's not really working. So I started to investigate organizations and individuals that were really, going what I would say beyond the walls. We're really reframing healthcare. And so I studied them, and I've continued to study them, and really look at, try to learn the lessons that they're teaching us. And in terms of what can we do,
Hmm.
there are so many things we can do. I think the for organizations today, people ask me that question. It's like, what can I do? What can we do? I think that we have to start to do a couple of things. One is I do think we need to take a divergent perspective and really learn these lessons and start to adopt some of what is happening across the country. And I can, dive into some of those details if you want, and some of those divergent perspectives and viewpoints. And we could spend quite a bit of time. And I think that's the good
Yes.
part about it, is that there is so much happening. So, for example, let's just one example, the issue of senior care. So,
Mm-hmm.
how does your organization provide care for seniors? What is the strategy? And I would argue, and I would suggest that most healthcare systems across the country actually don't even have a senior care strategy. They don't
Mm.
actually have a strategy for what they're going to do with the aging population that they're supposed to be taking care of. And so, what I started to do was actually look at organizations out there that actually did have a senior care strategy and were targeting seniors and really focusing on them and treating them as VIP customers. And so, an example, one of the first I came across was a company called Chen Med. And
Mm-hmm.
not only were they taking care of seniors, they were taking care of poor seniors.
Mm-hmm.
And these are the people that normally in most institutions would be going to community clinics. We call them dual eligibles,
Yep.
people, either on Medicare, Medicaid, and they would be relegated to some community clinic somewhere, and, seeing, doctors in training, but not even the same doctors, for most of the year. And they turned that around. And these people were not just getting decent care, they were getting the best care in the world.
What was the
And
secret sauce for the dual eligibles? Because usually they're hard to reach, right? They're Medicare, Medicaid, and so when they're dual, it tends to be harder to access. So, for example, they don't always have cell phones that are easy. It's hard to engage. It's hard to get them involved. So, how do they build that out?
yeah, I think we have to be careful with our perspectives. I think what you just articulated is exactly what the party line is,
Yes.
as opposed to saying maybe the problem is us and not the
Yes.
patient. And so they did some amazing things. They first of all, they converted their business model to a Medicare Advantage model so that they could have the funds to invest in innovation and invest in state-of-the-art
Yes.
care. So that was the first thing they did. And they actually started doing that way before they actually built their clinic model. They realized that this was just a better way to take care of patients, to be in a capitated model. And the second thing they did is given the fact that they were now in this capitated model, they didn't have to practice volume medicine. And so they reduced the panel size. Instead of, 1,500, 2,000, 2,200 patients, it was down to
Mm-hmm.
400 to 500 patients. So each
Amazing.
doctor had 400 to 500 patients. They could really focus on those patients. And they decided that they were going to treat those patients like family members. So the
Mm-hmm.
doctors literally, this is not just like, made up. This is very intentionally, the doctors were giving their, telephone numbers out to
Yes.
their patients, and literally, I want you to think about me as a family member. You call me
And
when you need me.
And were these people incentivized, like physicians, the staff, the nurses, everyone? Were they incentivized in the right way? Where, and also for the business model to be structured in the right way, where a panel of 500 instead of 2,000 was sustainable and people were not burnt out or overstretching?
Well, part of it was just, that reduction in panel size, so you could actually spend the time with your patients, right?
Mhm.
Number one, spend your time with your patients. Number two, reach out to your patients. If need be, go visit your patients in their homes. You could do that. But they didn't stop with that. They said, okay, we're going to actually train these doctors to really know how to deliver care to an older, sicker population,
Right.
including the psychosocial issues and social determinants of health. And so they literally have, when you join that organization, there's a 6 to 9 month training program where you get trained in how to practice medicine in a completely different way than the way you were practicing it before, a much more humanitarian, more humane way, a team-based way. On top of that, they built their own electronic medical record system that was customized for that specific population. On
Yes.
top of that, they actually started an analytics and data company. It's one of the best, and most people who, even those people who are aware of ChenMed don't know that they actually built a tech company. And
Yeah.
the job of that tech company, right? It's called Purity.
Yes, and it's been predictive, preventative. The models are all
Exactly,
very interesting. It's personalized so that it's actually catered to the patient. Um,
exactly.
I find all this really interesting. I think on
Mm,
top of that,
mm,
you're talking about new business models that make sense, aligned with both the payer so that employers, payers are incentivized to pay in a certain capitated model.
mm,
Um, Another question I had with
mm.
regards to all of this transformation is how do people get started with even this business idea? When they're thinking about it, how do they make sure they're aligned with the right staff and then the right technology and the right business model?
Mhm.
When you think about all these things, when especially for people early in their careers, when they really want to build something different, like you said.
Yeah, I mean, so I've now interviewed hundreds and hundreds of these entrepreneurs, like the folks at Chen Med, Chris Chen and Gordon Chen, and been studying them for a decade, and hundreds of others. And the first book I wrote, called Reframing Healthcare, really outlined their approach. They actually have a playbook, and I
Mm.
found a lot of commonalities in their playbook. And so I wrote, I that was why I wrote, you were asking me why did you, take the time to write these books.
Yes.
Well, after interviewing them for, a few years, all these entrepreneurs, I was like, wait a minute, they're all doing something the same. And so, and I'm happy to go into that. But I think that fundamentally, and this came out in my second book, Beyond the Walls,
Mhm.
I think there are three major ingredients, which, up to the point I wrote the book, I'd never read anything about this, but it was very, very clear to me. The first ingredient was that these people were all driven by a real humanitarian need. So the
Mm.
Chens saw the way that older people were being taken care of, in sort of these volume mills,
Mm.
relegated to community clinics. And they said, no, that's not the way we're going to treat these patients. And it was a real humanitarian cause. They are, it's just their mission is love. And
Mhm.
again, it's
Mhm.
such a radical, radical thing to say that our mission is love, but that's their mission. And so that's the first ingredient is what is the humanitarian cause? What are you trying to fix in the world? That's number one. Number two is, as I mentioned with Chen Med, there's always a business model that has to be attended to. And the
Mhm.
question is, what is your business model? And is it new and innovative? And a lot of these innovations that I've been studying for the past decade, and I wrote about in book number one, and even more so in book number two, Beyond the Walls, a lot of the innovations require a new business model, whether that's a new payment model or a partnership model. And I could go more into that because I think there are, one or two really important parts about the business model transformation that's happening across the country, which, by the way, no one ever talks about it yet. It's the reality. And then the
Mhm.
third ingredient is the digital revolution.
Mhm.
And so it is hard to imagine that we're going to be able to change what we've done, with the technology that is now completely outdated. And so, just like every other industry, these new innovative delivery models all leverage digital technology, and without exception. And so I
That's
think
great.
those are the three things. It's the humanitarian cause, the business model transformation, and the digital transformation. Those three ingredients are in every single hundreds and hundreds and hundreds of these new types of delivery models that I've studied. That they all have those three common factors.
I love it. It's like the triple threat to be able to build all three
Mm-hmm.
pillars.
Mm-hmm.
Can you explain a bit more about what you think in the technology transformation is
Mm-hmm.
happening and what inspires you to think about that for the future of healthcare?
Well, so here's the thing. Um, Digital is everything. I mean, everything in healthcare is going to be, if it's not already digitally enabled, it's going to be digital enabled. I mean, you look at every other industry, banking,
Hmm.
finance, entertainment, travel. retail. It doesn't matter. Every one of them has been transformed by the digital revolution. I mean, just think about the way we're communicating now. I mean, this
Hmm.
communication is 10 years ago, we couldn't have even made this up, and now we take it for granted. So it's ludicrous to think that healthcare is going to be the exception to that rule. And
That's right.
I think, this notion, and people are still arguing, and I'm reading even articles today, you know, what's going to happen to digital and healthcare? Are we going to go digital or are we not going to go digital? It is the most ridiculous, set of thoughts. I mean, it's happening. The cutting edge organizations and the leading organizations are engaging in it and investing in digital. And we have to do that. Yes, does payment have to catch up? Does regulatory have to catch up? Absolutely, but they will. And so I just, again, and every one of the people I've interviewed, digital has been core to the transformation.
Yes.
We're seeing it even now. I mean, you look at physicians, primary care physicians who are spending hours each day scribing and doing manual labor that is not even high school level work. Um, the digital revolution is going to take that work away so that you can
Yes.
actually
We're
focus
seeing
on
that
delivering care, right?
both digital, but there's everything
Mm,
from natural language
mm.
processing to being able
Yep.
to comb through medical records and pull out data to do prior
Yes.
auths to
Yep.
clinical
Everything.
dictation. And you're seeing also predictive analytics through the electronic medical records, right? And all that work
Yep.
to streamline it. Even summaries that as physicians, we used to have to, when we get an intake form, we're trying to figure out which patients are coming through the ER. You now can comb through medical records instantly in seconds, right? And be able to say, these are the most important things relevant to this kind of
Yep.
presentation. I'm also
It's
curious, as you're
yeah.
looking at all of these with new business models you just talked about,
Mm,
have
mm,
you looked into and thought about what types of backgrounds do people need to have when they're looking
mm,
at these companies? And what kind of
mm,
career trajectories are there? Do people come in from tech to
mm,
build a
mm.
clinical solution? Do people that are clinical need to build out their tech muscles? Or do startups that are, early stage thinking about it, do they have to build in the right strategists and the stakeholders and consultants?
Yeah, all of the above. I think what's exciting about healthcare, um, I'll just tell you on a personal note, I have a lot of colleagues who are very, very happy that they're kind of in the last part of their career. And I'll tell you that I wish I was at the beginning part of my career because there's
Mm,
never been as exciting at a time to be in healthcare as there is today. And it's for exactly what you just said. I mean, I think we're seeing, people come in from the digital tech world. I think we're seeing people come in from the business world, from finance, engineering, even new types of engineering that are being developed. It is just such an exploding, exciting place to be. In terms of an individual, I think we're going to need, and this I think is important. I think we're going to need two things. We're going to need diversity, and we're going to need divergence.
mm.
And diversity is really important. People from different backgrounds is really, really critical. But we're going to also need divergence of thought and of profession. And so, I think it really depends. I mean, if you're a physician and you're into, tech, that's great. You're going to bring something special to it. You could be, a person who's interested in policy and bring something to it, or business and bring something to it. So, or you partner with those people. So I
Yes,
think, there's so much more opportunity and there's so much more possibilities for people who are entering into healthcare. I actually don't even think it really matters. I think what's important is figuring out what you're interested in, and just taking it to the limit, and then finding others that complement you. Yeah.
I love that. I appreciate that. I think we're seeing this actually across the industry from the boardroom. We're seeing a lot more interest in diverging backgrounds. It
Mm,
wasn't traditionally, it was usually like CEOs or CFOs. sitting on the audit committee or whatnot. And now even on public and private boards that I'm on, we're seeing differences in people bringing in backgrounds that are different than what we used to have. I think on top of that, I agree with you. I like this idea of divergence. People that
Mm,
have different experience that can actually come together and argue and or bring their critical feedback on what's working, what's not. Do you also see the
mhm,
diversity in terms of backgrounds, people
mhm.
that need to be good critical thinkers or ability to connect the dots or to branch out of their ecosystem within, let's say, a physician, brick and mortar, to think about how do I change this structure right now? How do I think about payment systems in a different way? Are you seeing a lot of those new models coming out too?
Well, I do think this issue of divergence is really important. It divergence, and this is, by the way, is what I really been the principle I've been using. So I've actually been studying divergence, which
Hmm.
is, kind of interesting. I don't know anyone else who's done that. So I look for those folks who are, coming at this from a different background or a different perspective. And it just, I mean, I am so, it's just mind-boggling to me. In fact, every time I talk to these people, who, to your point, are seeing the world different than the status quo. They're seeing the
Mhm.
world different than I do, than you do, than the people who are running healthcare do, and and they have the skill and the expertise to actually take it in a different direction.
Hmm.
I think that isn't a good thing. I think it is absolutely critical. And it's critical because we're heading in a bad direction. So if things
Agree.
were okay, if things were stable, if things were heading in the right direction, then you'd be like, no, thank you very much. But they're not. And so it seems insane to me that we're going to be thinking the same things in the same way, asking the same questions, doing the same things over and over again, and thinking that somehow magically things are going to get better. So divergence in the dilemma we're
Hmm.
in right now, divergence is the only option we have if we want to
Right.
actually get out of this mess.
I'm going to ask you a little bit deeper on that because I think a
Please.
lot of people tend to be comfortable
Mm,
with their careers, and I
mm,
get asked all the time, I'm in pharma or I'm in med device or I'm a
mm,
physician and I want to do something differently.
mm,
But how do they, like, what is the
mm,
philosophy that you think about when they want to explore other options, transform healthcare in a different way, be an angel investor, think about becoming a chief medical officer of even a startup part
mm,
time? Have you seen those changes? And is that, I feel like that's part of the divergence of being able to live a little bit out of your comfort zone and
yeah.
taking a leap of faith and doing something different and trying to change healthcare in a different way.
Yeah, I mean, look, I don't think everyone has to be divergent. I think, you could be, a regular physician or a regular executive. I think it's I think it's to, kind of what you said before. I think it's who you surround yourself with. I think it's what
Mm.
you seek out. I mean, I'm a pretty standard, or at least I was a sort of a standard physician. I didn't have any crazy background or technical
Hmm.
background or, anything like that. But I think I've transformed myself mostly from just listening and seeking out these different
Mm.
thoughts and you know as opposed to putting up a wall and resisting and trying to cocoon. I welcomed divergence and sought it out and learned from it. And I think that's for me the most important lesson. And again, for folks who are trying to figure out their career, I think I think there's never been, there are so many possibilities, so many opportunities. And by the way, I don't even think you have to leave traditional healthcare systems anymore. I think there are so many systems out there
Mm.
that are really transforming, that you can stay within a large system and they're bringing in divergent thinkers, and you could
That's
become,
useful.
yeah, I don't think you have to go out necessarily. But I do think the systems increasingly more and more are and more need to continue to really bring divergence in. And it's, I mean, I
That's
just have
great.
so many examples of this that are, you know, even yesterday I was talking to someone, and I mean, I've been doing this for 10 years where I've
Mhm.
intentionally been seeking out divergent thinkers and doers. And literally yesterday I'm talking to someone and I'm like, they blew my mind. I was like, I never in a million years would have thought of what they were doing. And they weren't
Mm.
thinking about it, they were doing it. And I was just like, how did you even, I mean, where did you come up with this? And it is so the right thing to do for patients and providers and healthcare systems. And, you know, it's just, that's what keeps me going is just the realization that we actually can make a tremendous transformation in healthcare if we want to.
That's really exciting. I think one of the things that has really stood out for me as we're talking through this is that you are always inquisitive and curious about the world and willing to seek out not only the network, but the people that are like minded. In business school, we used to talk about finding your tribe and the ability
Mm,
to find people that will inspire you and make you want to be better. Um, I'm going to take this in the next couple of questions in a different lens and trying to think about it a little bit more personally and professionally from you. Could
mm.
you describe what made you change? As you said, you moved into a different role now. I think you're a big thought leader. And how do you describe, like, what's a day in the life of your work, and how do you balance all these professional responsibilities with what you want to do with your mission? Because I feel like your mission is really powerful. And I'll just say this: I think
Mm,
one of the meanings of life is to
mm,
find your gift, and one of the
mm.
purposes is to give it away. And I feel like you've really done that really well.
Well, Liz, you're very I think you're a lot wiser than I am. Uh, yeah, no, I agree with you. I think that's exactly right. I think it is, you know, I think it is our goal in life to find our gifts and uncover them and unleash them and our passions and share that with the world. I think that's the greatest thing we can do. You know, I think for me right now in my career, I'm doing a lot of speaking. I'm continuing, you know, as you know, I have a podcast and I just wrote a book a few months ago, or published it, and so I've had the opportunity to speak on it, and people are continuing to ask me to speak about it. I think where I want to go with this is to actually start to work with healthcare systems and you know, and bring this into systems and say, okay,
Mm-hmm.
listen, you know, let's sit down. Let me listen to where you are. Let me listen to some of your challenges. Let's see what you're thinking. Let's see what questions you're asking. And then, you know, again, I have encountered hundreds and hundreds, and continue to encounter these new ways of doing things, new organizations. And I think for me, the greatest thing would be to be able to help folks connect those dots, to help them bring in different thought and different thinking and different possibilities in terms of care delivery into their organizations for the benefit of, you know, their patients and the communities, but also for
Mm-hmm.
the benefit of the providers and staff in the organizations, because I think they're suffering as well, and I know they're suffering,
Mm-hmm.
and so part of my goal is to really help them, you know, with their own people as well.
That's a great mission. And as we wind down this podcast, I'd like to ask you some questions about that in terms of what philosophies do you believe that you've integrated, personal or professional, that have helped you and become instrumental in your success and in your ability to support others the way that you do now?
You know, I would say one of the things I really have come to cherish is focusing on other people. Um, you know, I have you know, spent much of my life focused on um, making myself better
Hmm.
and improving myself. And what I've discovered is that when I turn that lens around and focus on another person and get excited about another person and get very interested, as you said, curious and inquisitive, and enthusiastic, um, I find that I go to a completely different place.
Hmm.
Yeah, it's just, I don't think this was intentional on my part, but every time I stop focusing on myself and start focusing on the other, something magical happens. And so I'm exploring that more and more and seeing, how far I could take that. And and
That's
again, I think,
interesting.
go ahead.
I was
Yeah.
going to say, I find that whether it's like interview people or they interview me, when I put myself in their shoes and I really try to understand, like, what's the motivation between this interaction from the other person's perspective and mine, I think there's a magic that gets created when you really consider what they're hoping to get out of it, what motivates them, what are they trying to do? Is it that they want to build a business? Do they want to get information? Do they want to learn? Or are they more just trying to take up time so that they can check the box on that they met? It's fascinating. When I did medical school interviews, I interviewed at 4 places,
Uh-huh.
and I got into all 4. And it's surprising because part of it was just putting yourself in the shoes of the other person. What are they looking to hear, understand, and what do they want from you to feel bonded to you or interested or invested in you? So I wonder if
I,
there's a
yeah,
piece of advice, especially as you're thinking
yeah.
about.
Well, I would say I suspect that you did something in addition to what you just said, and and I find, I do this more and more intentionally. Is it's also asking the question, what, and I think you said it, what is this individual, what are they trying to accomplish? What is this group trying to accomplish? What is this organization trying to accomplish? And then the question is, how can I help them with that? And
Hmm.
I think I suspect you do that. And I know that, in fact, I was having a conversation earlier today and spent, most of the conversation just learning about this other person. And then I asked myself that question. I was like, I started to say, okay, how can I help this person? And it was really cool because I, in my mind, I could have been like, well, how does this help me? Right? I find that to be a default question. How does this help me? But when you
Right.
turn it around and you say, how do I help this person? And as I was listening to them, I was like, you know what? And they weren't soliciting my assistance, but I said, you know what? I think I could introduce you to 2 or 3 people that, might be able to actually take what you're doing and really scale it with you. And, and I think they were surprised that I went there. And maybe I was surprised that I went there. But what's really interesting is all of a sudden they were like, well, Zev, I really like what you're doing, and I think I could introduce you to some people. And,
Yes.
and it was just like, I don't know if that would have happened otherwise, but it definitely, again, it was sort of that magic of like, you know, really asking yourself, turning the question around, because you asked for, kind of a piece of wisdom. I think the piece of wisdom I'm learning is, and it's a hard lesson because it's not something we're taught, I think a lot, but turn it from like, how does this help me, to how does this help this other person I'm with? I
That's
think that's,
great.
yeah.
And as you mentioned, one of the things that I think are most powerful about leaders is
Mm,
to be stewards of their teams, their business
mm,
model, their goals, to
mm,
protect and preserve things that are truly important for the company, and also to make sure that the company's larger ideals are not only lived out, but employees also have that well-being in place. And you mentioned this idea of stewards. That word really, really
mhm,
stands out to me, to support innovation because it makes change less scary. And as you're building digital models or changing things, like, as long as you have that mission focus, um, I think about stewards too. And one thing that someone early in my career told me was to say out loud what you want from the universe, both for other
mm,
people to know, but also for you to have the universe be stewards for your journey,
mhm,
and to be open about that. And then, as you know, and reflect on what you can help others do in interactions. So I think I'll leave the
mhm,
podcast with that. You
mm,
have been so helpful and so interesting to speak to. So
Nice.
we've interviewed Zeev Neuwirth, and we're looking forward to your latest book. We are focused right now also on the Digital MD podcast because I think we have a lot of overlapping interests, and hopefully the listeners from this podcast will pick up your book. We have this other book coming out in July for Digital MD. It's Revolutionizing the Future of Healthcare. So looking forward to working with you on both changing our healthcare system and helping people find their career journeys and the love and passion that they want to have in their careers.
Well, thank you, Liz. What a great pleasure to speak with you. Thank you.
Good to speak to you too.